HIV who regularly take antiretroviral medicines achieve viral suppression. That is, the virus is kept under control at a very low level in the body. People with HIV who achieve viral suppression live longer. They live healthier. And U.S. clinical guidelines now recommend that everyone with HIV start treatment as soon as they are diagnosed. And that's really consistent with the way we treat most infections. When you have an infection, you treat it. And that's what we now recommend for HIV. Treatment is particularly important in terms of HIV because people with HIV who achieve viral suppression aren't just healthier, they're also less likely to infect others. In other words, good care and treatment are good prevention. But today's study shows that too many people with HIV aren't getting the treatment they need, in most cases because they're not receiving ongoing HIV care. Fortunately, once people are engaged in ongoing care, most are prescribed antiretroviral treatment and achieve viral suppression. That's why we believe we can make the biggest health impact by accelerating progress on retention and care. And that's where, at CDC, we're now focusing much of our attention. Thinking of it in terms of numbers, there were 840,000 Americans with HIV who didn't have their virus suppressed. That means that they were at greater risk for health problems and at greater risk for spreading HIV to others. Two-thirds of these had been diagnosed but were not receiving medical care. And that means that we need to do more with the healthcare system and with people living with HIV and AIDS. For people living with HIV and AIDS, it's not enough to know, you also have to go for healthcare. For healthcare systems, for doctors, for health centers, and for others, it's not enough to diagnose patients. You have to take accountability and responsibility for every patient diagnosed in your health center and